All right. So, hello, I'm Amber Yao. I'm a physician assistant at Loyola University Medical Center, and today I'm going to discuss the different ways in which poor mental health can damage your liver. So, our learning objectives are going to be to understand the functions of a healthy liver, to discuss mental health conditions and risk factors for liver disease, and to discuss the types of liver damage and their progression. So first, we'll discuss the normal activity of the liver and the various types of liver damage. So the liver has many roles. It's the body's largest filter. Your liver processes everything you eat, drink, breathe, and absorb through your skin. It turns nutrients into energy your body can use and removes harmful substances from your blood. It also makes bile to digest food, makes clotting factors to control bleeding, and helps our bodies fight infection. If the liver is damaged in any way, these processes can be affected. So we'll go on to discuss the types of liver damage. One of the earliest forms of liver damage is steatosis. So steatosis is when fat accumulates in the liver. It's normal for the liver to contain some fat. However, if more than 5 to 10% of the liver's weight is in fat, then we call it fatty liver. There's two main categories, non-alcoholic fatty liver disease and alcoholic fatty liver disease. Non-alcoholic fatty liver disease affects people who drink little to no alcohol. It affects about 25% of people in the United States. Risk factors for non-alcoholic fatty liver disease include obesity, diabetes, and high cholesterol. And patients will often have little to no symptoms. Alcoholic fatty liver disease is due to heavy alcohol use. It's the earliest stage of alcohol-related liver disease. So fatty liver disease is initially suspected if blood tests are showing high level of liver enzymes. However, other diseases would need to be ruled out through additional testing as well. And an ultrasound is often used to confirm a fatty liver diagnosis. The next stage of liver disease is inflammation, which is also called hepatitis. Hepatitis can occur due to the excess fat deposits, continued heavy alcohol use, autoimmune disorders, and viruses. Continued inflammation causes damage to the liver, and patients may have more symptoms, including some right upper abdominal pain, fluid collection in the belly or the legs, nausea, and jaundice, which is yellowing of the skin or eyes. If there's continued inflammation, it can lead to fibrosis, which fibrosis is the first stage of liver scarring. When the scar tissue builds up and takes over most of the liver, it's then referred to as cirrhosis. So cirrhosis is the term for advanced scarring of the liver, whenever hard scar tissue replaces the soft, healthy tissue of the normal liver. Symptoms of cirrhosis may include loss of appetite, abdominal pain, nausea, jaundice, easy bleeding, and then that fluid buildup in the legs or in the belly. Having cirrhosis increases your risk for developing liver cancer in the future. So if you are diagnosed with cirrhosis, it's regular liver cancer screening with ultrasound or blood test is recommended. There are two types of cirrhosis, compensated and decompensated. With compensated cirrhosis, your liver is heavily scarred, but it's still able to do its job. With decompensated cirrhosis, the liver is severely scarred and unable to function properly. And this is also known as advanced cirrhosis. There's no cure, but treatment can help to stop or slow down the cirrhosis. When cirrhosis can't be treated, the liver won't be able to work properly, and a liver transplant may be needed in that case. So this is just a diagram of the different types of liver damage that I've just discussed. You can see there's normal liver right here. The next step is the fatty liver, whenever the liver may become a little enlarged due to the fat deposits. Hepatitis, which is that inflammation, would occur next, which can lead to initial scarring of the liver, which is the fibrosis. Oops. And if the fibrosis or the scarring takes up most of the liver, that's whenever it becomes cirrhosis, which can in turn lead to an increased risk of liver cancer. So now we'll go on to discuss how poor mental health can affect your liver and cause these different types of liver damage. So mental health conditions such as depression, anxiety, stress, bipolar disorder, schizophrenia are associated with increased risk for substance abuse, poor eating habits, and chronic pain. So the complications of poor mental health can in turn cause damage to the liver. So first we'll go on with how poor eating habits can affect your liver. And mental health conditions such as depression and anxiety can cause increased or decreased appetite. Increased appetite can lead to overeating, and at times patients will crave certain types of food. So overeating, especially with unhealthy meals or with junk food, put you at an increased risk for diabetes, high cholesterol, and other medical problems. This could eventually lead to those excess fat deposits in the liver, which could lead to the inflammation and further damage to the liver if left untreated. And individuals with poor mental health conditions are at an increased risk for alcohol abuse as well. For most people, moderate drinking will not lead to alcohol-related liver disease. But according to the Dietary Guidelines for Americans, moderate drinking is one drink a day for women and 2 drinks a day for men. So examples of one drink include 12 fluid ounces of beer, 8 fluid ounces of malt liquor, 5 ounces of wine, and 1.5 ounces of distilled spirits. Heavy drinking is typically defined as consuming 15 drinks or more per week for men and 8 drinks or more per week for women. Binge drinking is whenever people drink a lot of alcohol in a short period of time. For women, having 4 or more drinks within 2 hours is binge drinking, and for men, it's having 5 or more drinks within 2 hours. While these are the current American guidelines, there's a new international study recently published in the Lancet Journal regarding risk thresholds for alcohol consumptions, and the new data supports alcohol limits that are lower than current recommendations, suggesting that low-risk alcohol consumption for both men and women is about 7 alcoholic drinks or less per week. So this diagram shows the progression of alcoholic liver disease. If you've been diagnosed with alcoholic liver disease, the single most important thing that you can do for yourself is to stop drinking. Abstinence is the only way of possibly reversing liver damage, or in more advanced cases, preventing it from becoming worse. So continued heavy alcohol use can lead to severe liver damage, including alcoholic hepatitis and cirrhosis. It's very important to discuss treatment options with your healthcare provider, which may include medications, counseling, or inpatient programs. Many people take over-the-counter medications such as ibuprofen and acetaminophen, other names for Tylenol. They take those medications to handle chronic pain like persistent headaches, back pain, muscle tension and pain. This type of pain can be a result of poor mental health conditions such as depression, anxiety, increased stress. While acetaminophen is often effective in treating mild to moderate pain, it's also the most common toxin associated with acute liver failure in the United States and other developed countries. So the toxicity is dose dependent, and it rarely occurs if people are taking it at therapeutic doses, which is up to 4 grams or 4,000 milligrams daily. And that's the therapeutic dose for a patient that is without any pre-existing liver disease. So that's about the equivalent of taking 12 regular strength Tylenol in 24 hours. Some patients will unknowingly take larger amounts of acetaminophen when taking multiple acetaminophen containing medications at one time, or if the medications are not taken as directed. Acute liver failure can also result from normally therapeutic doses in patients who have other liver disease, particularly those patients that are using alcohol at the same time or taking other medications which can affect their liver. You are at an increased risk of having hepatitis B or C if you're sharing needles to inject drugs or sharing straws to snort drugs. The hepatitis virus is spread through bodily fluids such as blood, and patients with poor mental health conditions are at an increased risk for substance abuse as well. So these viruses can cause inflammation of the liver. The inflammation can lead to scar tissue, which can interfere with the normal functions of the liver. There's currently a 3-step vaccine to prevent hepatitis B, and there's no vaccine currently to prevent hepatitis C. The majority of patients who get hepatitis B, about 95% of patients will only have it for a short period of time, and it will get better on its own. About 5% of patients will go on to develop chronic hepatitis B. Medications usually aren't used to treat acute the short-term hepatitis B, but if you have chronic hepatitis B, you should be monitored regularly for signs of liver disease and the need for possible treatment. There's several medications approved to treat chronic hepatitis B, and other medications are being developed. There is some people who get hepatitis C will only have it for a short time as well. But most people, about 75% to 85%, will go on to develop chronic hepatitis C. And unless successfully treated with medication, the chronic hepatitis C can eventually lead to cirrhosis, liver cancer, or liver failure. There are now more medications available to treat hepatitis C than ever before, and the new treatment regimens are shorter in duration, easier to tolerate, and they're more effective than they were in the past. So the biggest way to protect your liver is by maintaining a healthy weight, consuming alcohol in moderation, being aware of the medications that you're taking, even over-the-counter medications. You want to make sure that you're not duplicating the main ingredients or taking medications that can affect the liver in different ways. And you can protect your liver by talking to your healthcare provider about your mental health, any substance abuse problems, and ask them about screening tests as well. So you should talk to your provider if you've never been vaccinated for hepatitis A or hepatitis B. That's a way that you can protect your liver, is through prevention. You should talk to your provider if you're a heavy alcohol user, and you can discuss treatment options with them. If you've ever had a history of IV or nasal drug use, if you're having symptoms such as persistent upper abdominal pain, nausea, loss of appetite, swelling in your legs or in your belly, or the yellowing of your skin or eyes, those could be signs of liver disease. And if you've been feeling depressed, anxious, or if you've noticed any other changes in your mood or behavior, it's recommended that you go speak to your healthcare provider as well. These are some of the references that I used for this PowerPoint presentation. They're also good resources for patients as well. I just want to thank you for allowing me to speak today on how poor mental health can affect your liver. Thank you.